Thank you, everybody, so much for joining me today. My name is Regina Yuen. I'm a nurse, and I have previously worked with MSF as a nursing activity manager. And so today we're going to be speaking about bridging into the humanitarian sector in humanitarian health. And here are some of my lessons from the field. So we had some discussions with other global health and humanitarian folks before. And so while there are a lot of recruitment webinars and videos out there, a lot of us have kind of reflected into this barrier of entry into the field, um, which means that, of course, the competencies they require can be quite difficult to achieve or maybe not as clear. And so Wow, I do think this is good because, of course, the job isn't easy and it's really good to be prepared, but every now and then it can still be difficult to assess what to do. So I'll just discuss a little bit of my journey today. It might look different from everybody else's, but maybe provide an idea. So, a little bit about myself. I had decided to become a nurse because I really enjoyed talking to people and I just wanted to help. And so I thought that would be a good pathway and I would just give it a go. And during my bachelor's, a field nurse from MSF had presented at a nursing conference that I had attended, and she spoke really passionately about working with populations, which really piqued my interest. And so at that point, I had done a really deep dive on humanitarian health and was really inspired by the mission of MSF, as well as their principles. And I thought that really aligned with my values. And of course, the medical ethics of treating everybody, regardless of where they come from, what their orientation or gender was. And it was, of course, the neutrality principle. So I thought, wow, this is the dream. This is what I'm going to do. This is my dream job. And so I looked on their website, and of course, it required some specific clinical skills. And so I set out to try to see where I could gain those skills to try to get some of my experiences in. This brought me to a couple interesting places, as you can see from my roadmap. And so while these objectives may have changed now, and so of course, you're welcome to go on their website to see what the requirements are. But at the time for me, it was several years of experience in an ER, OR, OB, or PEDS. And I thought, wow, working with babies and kids as a new graduate nurse might be a little bit overwhelming, and same with working in the operating room. And so I thought, well, let's give the ER a try. I feel like I'd be able to see a lot of things. And so that's how I got into the ER. And there also required experiences within public health, infectious disease, speaking another language, gaining leadership experience, and getting some field experience within a context that's more low resource. So that could be overseas or within the Canadian North. And it also helped, I suppose, if you wanted to get a little bit more information about tropical medicine or about public health. So if you had a degree or a diploma. So, getting started with my journey, when I was in my bachelor's, I had also decided to do an exchange, and so we had two places to choose from, and I had chose Sweden. This also provided a good perspective in another health system and culture and traditions, and so that was a really good first foray into living in another country for the first time for me. And getting to live with people and meet people from all over the world. And so I think they also ask sometimes, have you traveled? Have you been able to experience these different things? Because I think you're going to be working with a very multicultural team. So I'm going to talk a little bit about my employment experience and what it taught me and how it shaped me as a person, and then how it led to my time in the field. So the first is Detroit, Michigan. I actually had studied in Canada and I live in a border city. And at the time of my graduation, unfortunately, they had said, "Oh, we're not hiring frontline workers at this time." And I thought, okay, what to do now, because I studied all of this and I worked really hard and I was really looking forward to getting started to work as a nurse. And so I was recruited to go work across the border in the US in Detroit, Michigan. And so for those of you that don't know, Detroit, Michigan um, had suffered, I think, from bankruptcy. So 10 years, 10 to 15 years back. And so they were struggling with a lot of things. And so when I had entered the emergency department, it was mostly a lot of systemic and burial structures that I've seen. And so I had began working in the emergency department, and it was also a level one trauma center. And so, of course, when people think that, they think gunshot wounds and they think stabbings and they think, wow, what's the craziest part of your job? But actually, I saw things quite differently. And so when I first came in as a nurse, of course, that's really, really exciting, to be gaining all of these new skill sets. Um, and of course, adjusting to working in a different health system and getting to know your time management. But day to day, I also saw a lot of things that I thought was quite preventable. And so, of course, you're dealing with people that were coming from emergent health concerns like your chest pains and your abdominal pain. But at the same time, I had also realized that a lot of people were coming in with things that were a lot more complicated with psychosocial issues that were homelessness, and addictions and mental health issues that, they weren't really able to get treatment for. And this honestly disheartened me a little bit because I felt like it was um it was a banded solution to what we were providing. And of course, people every now and then would come in very, very, very sick, because they didn't have access to medications and they didn't have access to things that were crucial. So, for example, the air quality can be quite bad because of the manufacturers around, and so people that would suffer from asthma that went without their inhaler now suddenly would go into respiratory arrest. And so I just was quite burnt out genuinely after 2 years, and I thought, let's look at prevention because when you're working in a tertiary system, you think you're trying to fix all these problems, but sometimes they're beyond just the immediate clinical perspective and what you can provide as a clinician and treating those things, but also in a broader scope. And so throughout this time, I was still thinking about MSF and set out to upskill myself. And so during this time, I was also volunteering with the global health team and gaining some leadership experiences with volunteering. And so was in Detroit, and after 2 years, we were going through really the worst of COVID. And it was really quite vulnerable. And so we had volunteered to complete needs assessments and do swabbing in the communities. And so that was really great to be part of that program and part of that process on the ground and kind of see how community health can be distributed in a very, very effective manner. Next, I had moved on. I said, now, okay, you know what? It's prevention time because there's a lot of very complex psychosocial issues that I couldn't fix, and I thought, okay, you know what? I'd really like to look at how we can even prevent all of these issues because, of course, within the tertiary system, once people get very sick, not only is it more difficult to save them, the outcomes are worse, but it's also very, very costly. And so within the public health system, if you are able to do prevention, it's much more cost effective. People are a lot safer and they don't have to go through all of these things and possibly suffer from disability. And so I moved to the subarctic. I moved to Yellowknife in Canada, and that's in part in to get more experience in public health, but also because I was always been very interested in Indigenous health. And so I saw a lot of similarities between traditional medicine and Eastern medicine coming as a Chinese immigrant. And I also had learned a lot about the horrific history that had happened to the Indigenous folks during my studies. And so I thought the interventions to combine, traditional medicine and Western medicine was always the most culturally appropriate manner. And so I set out to gain some of this knowledge. And once I got there, I started working with the public health clinic and gained a more experience in well child. And so if anybody that's ever worked in the hospital are aware, whenever you're working with a specific population, you're like, I'm really confident with adults, or I'm really confident with peds. And so it's really great to get a new perspective with a different population. So through this, I learned a little bit more about vaccinations, and unfortunately, the Canadian North suffer from twice the amount of incidence of tuberculosis in the Canadian South. And so I learned a lot from my colleagues during this time about the treatment programs, um, and a lot of the psychosocial issues, sorry, that were surrounding that as well. So during this time, I met the territory manager and was recruited to give vaccinations. That was when the Moderna vaccine was first rolled out, and remote communities were very, very vulnerable. And so after the residential schools, of course, the the indigenous people had suffered a lot during that time and also from very, very trusted people, very trusted folks from the government and also from the medical community. And so this had took a lot of trust, especially given that it was a new vaccine. There was a lot of misinformation around at the time, and then also with the history behind it. Um, and so this taught me a lot about health education because during COVID, we had learned a lot about vaccine hesitancy, and which is to say that, despite your education, despite regardless of what you've known, even if you've trusted vaccines before, a lot of misinformation can really, really impact your trust. And even if you were to explain with a lot of facts, sometimes it's emotions. It's a lot of times it's emotions that can impact your decision. And so, what we were having to have a lot of discussions with leaders and elders and to build a lot of that trust. And so I really, really give a lot of props to the nurses and especially Indigenous nurses that came before me to build those relationships. And so that was a lot about health education, forming partnerships, and then how you're able to, go to a community and be able to establish that trust, establish that partnership, and and at that time we were able to vaccinate a lot of communities. So I was very grateful for that experience. I then moved on to the Canadian Red Cross. I was supervising a swabbing clinic, and so it provided a little bit more leadership experience because that's also what a lot of the humanitarian health organizations were seeking and a lot more about cold chain and setting up a temporary structure to complete a program. So at the time, it was at a border crossing. And so, what used to be a parking lot now was a structure that we were able to operate a clinic out of. So, throughout this time, I had bounced around a couple times now, and while I loved every single one of my jobs, I also needed to do something for my personal career. And so I've always loved the outdoors, and so had decided to venture off to California. This had provided a different perspective on health systems because despite having worked in the US already, some of the resources were very, very different. And so I can see that based on policy, how something impacts your health systems and the resources that patients are able to get and that you're able to work with. During the full force of the pandemic, I also felt very helpless, within everything, within the structure, working in a frontline worker. And so at this time, I was kind of thinking about what to do next and how can I make a bigger impact. And so I had sought some advice from my mentor, and he had encouraged me to attend grad school to gain more knowledge. And he had encouraged me to apply to the same school as he did. And I thought, that's bonkers. I'm never going to get in. That is a huge school. It's impossible. It's out of reach. And he said, just go for it. You know what? I think, you're just use your experiences, explain why you want it. And I think I was able to get that across in my essay because I got accepted. And so I deferred a year because it wasn't the right time for me. But when I went in, I had studied public health courses that focused on biostatistics, epidemiology, public policy, behavioral change, and within my specific concentration was humanitarian health. So it was really wonderful to learn more about the greater health systems in play in a camp setting, working with refugees and internally displaced populations, and during my time, I had also completed a field visit to Bamako in Mali as part of my practicum and connect to nurses about their day to day and what it looked like. So after all of this, years later, I had applied again and was accepted into MSF. So there was at one point prior to during my master's program that I had applied once, and as we say in the humanitarian setting, it's feast or famine. And so they said that, we recognize that your skill set. However, there are just no postings at this time, so we'll keep your number around and we can call you if something comes up. But otherwise, please come back next year. So I will say that they're really, really great with the recruitment process, and they also provide some advice about what you can improve on in the meantime. So all of this explanation is to say that once I arrived in the field, I valued each and every single one of these experiences. I thought it all taught me something different, and that was really, really applicable to me. And so it really is about the journey, which I didn't believe at first because I was really restless. I really wanted this job. I really wanted to get to the field. And even actually, once I arrived, I was speaking to one of the staff members. And they asked me about my age, and I said, "Oh, I had worked in these years before in these other places." They're like, "That's good because you look young." And so, this can also be about people's perceptions of you, right? And as a leader. And so, all this to say that, I arrived at the time that I was supposed to, and all of these things have lined up for me to gain the skill set that I needed to lead my team at the time. So I also wanted to say that I've had multiple people after I finished this job and they had come and approached me to ask me about my experiences, and they said, and personally as well, when I had done a lot of reading and watched videos about the field, I've always thought I had to do it before a certain age. Maybe that kind of led to this part of restlessness as well, because I thought, oh, I thought you had to get in there early, and and then once you maybe want to start a family or continue on, it may be difficult to go to the field. And I found out that's not true at all, which is great news. And so when I was during my orientation, I had met people from all walks of life, and that said that some of them had even said, this is something I really wanted to do when I was younger. However, I had to, there were other priorities at that time that I had to do. So I ended up raising a family, or I, prioritized my career. And then here I am years later. And so, to anybody that's thinking about this and thinking that, okay, I can't because of XYZ, reach out to recruitment, reach out to other people, complete your informational interviews, because you can find that some of those perceptions are just not true. And there are people of all ages that are working there, and sometimes with families too. So do what's best for you at your time. Can we please get the next page? So, of course, what to expect. And so I'm not going to speak too much about the recruitment processes because, of course, this is on their own page. There's a lot of webinars and videos out there. And depending on which humanitarian health organization that you wanted to work with, may have different things. And so for me personally, once you're recruited, you will be matched with a project that's suitable with your profile, skill set, and language capabilities. And this may take time, right? As we had said before, it's feast or famine. It's dependent on the projects that are available. So even once you enter the organization, you might have to be a little bit patient, which for me is difficult because I get really, really excited. And so as well, first projects are typically in a more stable context. So of course, when people see a lot of news going on about the current conflicts or current natural disasters, they say, I want to go there. And so that's, not necessarily how projects are matched. And so, of course, you have to kind of gain your experience, gain your expertise, and then, of course, the experts at your organization are going to be able to assign what's best for you. And next page, please. So day to day, I oversaw 2 units and all of the nurses that were on that unit. And so my primary focus was on training nurses to recognize critical and deteriorating patients. And so, of course, day to day, when people are on an inpatient ward or in the ER, there's different levels of acuity. And so we're learning to recognize some of those symptoms, vital signs, and the day to day. So I had to be very, very present, and so on the wards to be able to assess, okay, here are the patients and the families that we're working with today. Has anything changed? Are there any needs that they need to be met? Any resources that they required? And so, can work with individual nurses and also with the nurse supervisor to identify some of those needs. Um, when I had first arrived, a lot of people had offered advice, and during the orientation as well, to just listen. Once you go there, of course, every time you go somewhere new, even starting a new job, you say, you know what, I don't think we quite did it like that at my old job, and I think and this can be improved. Well, typically now that I found after gaining my experiences that there's a reason for the way things are done, right? And so that can be due to policy, that can be due to, things that haven't been implemented in the past. And so when I first arrived, of course, I was really antsy to get started. I was really excited. So I thought, let's just take a step back. You're in a new context entirely. And so just observe, would speak to the nurses to ask, hey, why is this done the way it is? I would speak to the nurse supervisor and ask, what has been done in the past? Why did it work? Why didn't it work? And to listen and learn from the advice to nurses, because of course, as any organization, you're going there under your official role, maybe as a leader, as a manager, but we also know that it's very, very crucial that you learn just as much. And so it's a very, very reciprocal process. And so I'm very grateful to the nurses for being so patient with me, and for everybody at the hospital for being so patient with me. And so as well, when you're working in a traditional hospital setting back home, there's a lot of things that you don't see that make the hospital run. And so within a smaller context, you have to kind of see the flow of things, right? How are we working with the lab? How are we working with the other practitioners? And so that was really, really great because you're able to get a sense of the health systems. So I took the time to do so. I would closely collaborate, gain insight to what the nurses felt they need, and depending on your role, you may have to also do administrative duties, right, as a leader or manager. And so there was another nurse manager, but I would also cover them when they were away or on holiday, and had to learn a little bit more about the HR processes as well. And so, if you're practicing clinically, these are some new skills that you may have to gain along the way. You may be also given objectives in addition to what your primary role is. And so I was able, for me, that was also to implement palliative care. And so a lot of specialized services are often missing from the humanitarian setting. And so it's very, very difficult because they require typically specific resources. And so you have to try to be quite creative and innovative. And so, working as an ER nurse, of course, we would have experience with palliative and end of care patients, but that's often quite difficult because there's a lot of things going on and things are off typically moving very, very quickly. And so, I was quite fearful at first because I thought, okay, you know what, within my scope, this is what I've learned. But I would say don't be fearful at all because even if something that's outside what you perceive your specialty to be, or maybe you're lacking knowledge in, there are always resources like specialists that you can reach out to for help. And then, of course, a lot of internal documents that they've gained expertise in, right? And so, the humanitarian organization that you're working in are experts in what they're doing. And so they've gained research, they have a lot of expertise that they have utilized throughout the years. And so I was able to have a manual that I was able to refer to. And then whenever there was something that I needed more from, reach out to other people and also the members of my team because they've also done other humanitarian experiences before. So then I was really able to draw on their expertise. I was thinking that, as it was my first project, I would need a little bit more guidance. And so something I had done for myself as well, that I had approached my manager and asked for one-on-one time to bounce ideas off. So that's another way that you can gain some more insight. And so just definitely advocate for yourself because things get very, very busy in the field and your manager is also wearing a lot of hats. And so it can be overwhelming to kind of assess for yourself as your first time what to prioritize when you have a lot of things competing, a lot of competing objectives. And so definitely try to, work with your team and to see what can be done. So on the day-to-day, of course, you have trainings for staff, and so I would work with the supervising nurse to see what the gaps were, and say, okay, you know what? I think today we can focus on mass casualty incidents. Today we can focus on basic patient care, and that we can recognize the signs of shock. And so, it was really, really interesting because these trainings were quite dynamic. And so you would try to plan them out, but then something else that would come up to be a little bit more critical. And so definitely have to a little bit innovative and creative, so, and also flexible about how you do these as the needs evolve. And so, lastly, you can also be called to do patient transport and within the communities. And so, and you'll be accompanying them and ensure that they get to the hospital safely. And so, schedules get shifted around all the time. And so, you may think, okay, today I have XYZ planned. And then in actuality, maybe they'll just need you the day of. And so, you have to think, okay, let me just switch this around and I can reprioritize. And so within the photos, as you can see, I typically within all the photos, I try not to show the any faces of my team members, of course. And so, of course, this is some of the trainings that we were able to do. And then you're also working across teams as well, across disciplines. And so even though you're in the hospital, you may be working with health promotion that's in the community. And so not only can you provide trainings, you can also be providing for your team, but you can also be providing trainings for all of the other teams. And lastly, you also have to attend trainings for yourself. You're gaining a lot of insight. This is something that's very, very new. And at the same time, when you're working in clinical practice, we can get very, very focused in very specific diseases in the minutia. But sometimes we need to broaden our horizons because when you're working in the humanitarian sector, it goes beyond just the hospital, right? You're also thinking of a camp, thinking of security, all of these things. And so it was very, very interesting for me to learn across disciplines. May I have the next slide, please? So, um, after work, what do we do? So, depending on your context, um, you may be very, very free. You may be able to walk around freely. It's very, very safe. You may be able to do some hiking, see some nature, but in different types of contexts, you may have a curfew. And you may be just behind a wall after a certain time, after dark, for safety purposes. And so, of course, your team is going to ensure that you're safe there this entire time and provide very, very clear instructions to what you can do and what may be appropriate, what may be inappropriate in the communities as well. And so after work, I would say that a lot of the teams really, really prioritize avoiding burnout because every now and then these hours are very, very long. As different objectives pile on, you may feel like that you have increasing level of workload, especially when you were just observing before. And so, and you also have different meetings across different disciplines, right? And so you're constantly in contact with different folks. And so I think within my team, of course, there's going to be things that work differently for different people. But of course, you have to share a lot of your experiences in order to be able to, gain some insight, but only also to rant every now and then. And also try to share mealtime with your colleagues, right? And so you're living with a large global team. And so after work, you might say, you know what, it was a 12-hour day. I don't want to speak to anybody today, but, there's these things that a lot of things that they recommend for you to do. And it's for good reason because people have been through very, very distressing contexts. And it's very important for us to ground ourselves after the day. And here are some activities. I know these pictures are a little bit quirky, but something that was my personal favorite was going for coffee in the market. They make this very, very lovely ginger coffee in South Sudan. And so that was always something that I look forward to. And, that was marked the end of the week for me was, okay, I'm gonna go there. I'm gonna be able to do some shopping for my needs and then, go grab a coffee and just sit and relax. Another thing I really got into was exercise. And so I had my phone that was at the ledge, and I would just have to really, really peek to see what the video was doing. But of course, that was really important for you to be able to get some stress out. Of course, your team could also, as a group, come up with different ideas together. So one big thing with movie nights, they always recommend for you to, bring a USB or bring what are those called? Those internal memory disk. We know what I'm talking about. Anyway, and to bring lots of movies. And so every now and then it would be fun because we would do a poll and we would argue about what movie we wanted to watch. And some people were like, I'm so tired of watching Disney. And so it's a good way for you to be able to connect and to be able to decompartmentalize at the end of the night and to set up something special because it's not something that we're able to do very, every single day per se. When I was in the field, I read a lot of books, which is great because, when you're in the day to day, you say, I'm gonna get to it, and people keep giving you new things to do, and you say, I'm gonna make time, but you never make time. So that was great because I was able to get through, I believe, 15 or 16 books when I was in the field. Of course, they always recommend for you to chat with your friends and family. Of course, this is dependent on the internet, but I think we had pretty good connection there. And so, of course, would keep in contact with them, update them to my day to day, week to week. And so that was also really, really important for you because a lot of people also get very, very homesick, understandably so, for you to be in the field, depending on your time. It could be 6 to 9 months, maybe 1 year. So every now and then you do get some time off, but of course it's limited and you're not able to see your family as much, and this can be quite difficult. And so um, every day there was one day of a week where we would also cook together, and so we would host a barbecue. And so we would all assign different tasks, right, to each other. And so, of course, um, in the day to day, if you've haven't had to deal with when you show, you're used to going to your just grocery shop and getting it, but every now and then you may have to like arrange some things, for a goat to be brought and then to be slaughtered, and you're doing really, really with from the most organic manner, let's say. And so it was a really great way for you to be able to connect with the team and to do, one big task together for something very, very fulfilling. And at the end of the night, we would always end with some dancing. So that was great. So if you if you're a dancer, get ready because everybody's such a great dancer on the team. It's always a great time. And so I think by the time we had ended, there was some other people that really also like dancing, and we were learning choreography at the time, and it was kind of like your little cousin that was like, hey, watch what I can do, and we were just performing dances, and with your bosses. Think about it; these are people that you're working with, right? With your bosses, with your fellow colleagues, and so they really do get to see the best and worst of you, and then for them, that was my dancing. Um, and then you're also able to think of really, really fun things. And so, after a day that was quite distressful for a lot of people, some people bring in their own things. So for me, I had brought some embroidery, some things I've always wanted to try, but that was light because you also can't pack much. And so, I had brought a watercolor kit and I had started something called a watercolor corner. And so for very, very distressing day, you would break open the supplies and say, hey, I'm arranging this at this time if anybody wants to chat, And so it's based on, your team, but also, you also have to play a big part in, um, I guess considering your own feelings, but also your team's feelings. Because again, you're living with everybody. And so this is something that, might be difficult if you really, really treasure your alone time. But, of course, there's a time and a space. And so that was a big part for me was to connect with my team, especially really during very difficult days. And then we can move on. Thank you. So, now based on my experiences, I guess I can kind of share some competencies that I thought would be quite useful in the field. And even when I was applying for roles after my master's, I had applied for other NGOs for different types of roles in addition to MSF. And so these are some of the competencies that I repeatedly saw throughout this process. And so within leadership, I had discussed a lot about what my day-to-day looked like. And so of course you'll be managing, you'll be supervising, you'll be training. You'll be provided different objectives, so you have to really learn how to balance your time. And something that was really important for me working with MSF is that one, the majority of the staff are national staff, which means that anybody that's working inside the country, of course, are fully capable of deciding their own future. Because they're living in a difficult context, it's temporary. And so we're there to provide temporary help, but it's really important that these skill sets are provided to them so that after you leave, they're able to staff their own hospitals and provide help to their own people in the way that they know best, with cultural competence. And so local knowledge is super, super crucial. And so all of this to say as well is that, during difficult contexts, the staff are also living a double burden. And so, while they're working very, very long hours alongside with you, they also have to maybe go back and experience some difficult context, right? And so this is something that I really, really take into consideration as a leader, as a manager, to say, okay, based on XYZ, based on local events that people also share, what can we do today to the best of our ability, or what do we have to take into consideration? So that people can perform their best. Um, and so as well, this is also to say that, of course, there's also a lot of competing priorities that you have that I have already discussed. And so I have to find the best way to not overwhelm my team because of course there's always something to be learning. But if you and I were learning every single day, would we really be absorbing the information fully, right? Because they're still doing their day-to-day job. And so that was also quite difficult to balance. That's something that you have to consider and to say what's the best way to implement what at what time. Of course, cultural competency, this is something that we've seen across in the field. You're working in a different context with a very global team. For me, my team was quite large, and so you're living with people from all over the world. But that also means you're working with different from people with different leadership styles, right? Different ways of doing things, different leadership styles, and based on where their home was, that also led to what their day to day looked like, and it may differ a lot from yours. And so, you have to kind of find that common ground and say, hey, you know what, in XYZ we practice in this way, but can you please tell me and share with you, and maybe we can find some common ground and similarities. And then, of course, most importantly, the documents that are provided by MSF, you're able to refer to, right? And this is based on how they would we would practice in the field. And so language barriers and differences in communications in the house or work can sometimes lead to misunderstandings. As English was my second language, I also understand that sometimes when you first move, I was unable to find the right words. Things can come across very, very direct. In When I first moved to Hong Kong, it was quite normal to comment on people's weight and say, when you first approach somebody, they would say, "Oh my God, you've really gotten fat." And that's something that's not you would not say in Canada whatsoever. It's not acceptable. And so I'm sure a lot of people have had experience situations like this. And so that definitely be very, very conscientious. And whenever you're having a conversation with somebody, and the people are very, very talented, they speak multiple languages coming from everywhere. And so within all of this, things can get sometimes lost in the mix. And so I would say try not to take anything personally. Whenever you hear something very, very direct, and then just be, maybe discern the meaning. What are we really looking for, and what solution, are we trying to provide today to a certain problem. Personally, I was also told that I speak very quickly at times, especially when there's a lot of things to be done. And so when you're working with the global team as well, again, um, it's something that I have to continue to work on and be mindful of, right? And so these are some things that you pick up along the way. And so your language capabilities. And so, of course, depending on which context you're working in, which countries, they're looking for fluency, certain different levels of fluency, which they will list. But some languages that I have seen across the field were French, Spanish, and Arabic. And so where I worked, the team members also spoke local languages, and there was an interpreter. And so we were able to discuss in English. Of course, it's always good for you to learn a couple words as best as you can in the local languages, or in Arabic as well, which is also what South Sudan had spoken. And so to, of course, be able to connect with your team members. So, adaptability, you have to be very, very adaptable, because, of course, every now and then you're working in low resources, or every now and then supplies are just backed up. And so, because of the weather, because of different things, because of priorities, you may not get the things that you require to implement your programs as fast as you'd like. So, in the meantime, you have to be creative and innovative and work with what you have and roll with the punches, because, of course, every now and then things change very, very quickly. So when I was in the field, there was two different mass casualty incidents, and so within one of which that I could not go to work, and so you were trying to manage everything um, uh, on a phone, and so trying to get the update, ensuring, hoping that your staff was safe and the community was safe, and so this is you definitely have to think of new ways to be able to aid from afar, to help from afar. Um, and then as well, like I had said, every now and then you might just need to do transport, or things that would come up like the day before or the day of. There's a training, there's this, there's that. And so to be able to adapt quickly and not be able to say, okay, I had a schedule, because, when things are changing, when that dynamic, the schedule is irrelevant. And so when I had first arrived, of course, I had understood that it was dynamic, but of course, I wanted to set a training schedule so my nurses knew what to expect, right? But of course, that these things would come up, but every now and then it just wouldn't be a good day. We were short-staffed, people were running around, and then are people really able to learn during that time? And so, of course, you'd have to change some things around. So I would try to be flexible and work with the team to find a new time that worked better for them. And finally, readiness to learn. And so, not, I had, spoke about some of the resources you're working. The local staff have been around for a very, very long time. They know their health systems best, they know their communities best, and what traditions, what their needs are. And so, of course, you're learning a lot from your staff. So, ask a lot of questions when you first arrive. And of course, to work alongside with your supervisor to be able to get the needs that you have, and also from your teammates. Of course, the staff members that you've been working with, they've done multiple projects prior to this, or maybe they come with a very different experiences. And so you're in a new environment, and based on whether you're in a community or camp setting, the infrastructure and the systems you used to may be fractured or non-existent. So you have to rely amongst yourselves and to think, how can we solve this problem together? And then also, when we're working in the clinical sector, of course, we have a very, very specialized knowledge, but the humanitarian field is huge. And so, you can a specialist come to a focus training, but, you're also learning about completely new things like security, negotiation, about water and sanitation. And so definitely come ready to learn because there's a lot of things that, that will be very, very new. And so what you see within the pictures, that's my team, and I was saying goodbye. I was probably crying in that picture. And this is also speaks to, forming the relationships with your team. Every now and then you're there for only a determined amount of time. And so, of course, for you to be able to be effective and be able to provide trainings or education, it's really important to form those relationships. And so, of course, we would also share coffee time together and be able to discuss what their needs are. And then next page, please. So, continuing with competencies, I would say that this is so dependent on context. And I'm just really, really emphasizing that every project is different. When I was doing my informational interviews, I had spoken with several doctors, several nurses, different logisticians, um, and they had provided something different, a new knowledge every single time. And so, based on where you are, who you're working with, um, the knowledge that I think is crucial may differ from that. And so within health systems, you're working with other NGOs. And so, when you're working somewhere, maybe you're overseeing this unit and that unit, but somebody else is overseeing OB, somebody else is overseeing neonatology. And so typically when you're used to transferring within, okay, we know that we're going to transfer here when this patient is sick, those referral pathways may be fractured and may be non-existent, right? And so you're having to work a lot with new people that you may not be familiar with, different organizations that operate differently, and so again, also to be very open-minded and flexible. Um, and so this also is important to ensuring that the needs in the patient's families are met, right? And so for our personal experience was that our neonatology ward was different. And there was another NGO or Ministry of Health that was overseeing obstetrics. And so this can be quite difficult after mama has given birth and the baby needs to be transported to be observed, right? And so these are things that you need to think about to see how can we safely get this patient to the next point. Within camp management, I had spoken a little bit more about this already, but of course, ensuring that people are safe, ensuring security. Every now and then there may be fights, or conflict within the settings. And so, you think, okay, well, I'm not directly overseeing this, but this does impact your patients, right? So within the security, it impacts sexual and gender-based violence. Within the water, this can lead to cholera, and based on hygiene, based on how they're managing the latrines, based on how they're managing the camp, and whether there's overcrowding, this can lead to different prevalence and instance of different diseases, especially during different rainy seasons or when there's changes in weather. So, these epidemiology trends, of course, can provide some data as to what to expect, and to be able to best prepare for that. But what, I think getting an overview and getting some more knowledge of how the system works beyond just within the health system provides a lot of knowledge to how it's going to impact your patients and your population. And so lastly, a lot of people think, okay, I'm going to get my diploma in tropical medicine. I'm going to get more knowledge in this, but it may be helpful, especially with tuberculosis and HIV. But we have to remember that the number one killer is still non-communicable diseases, right? And so to discuss, what are the psychosocial needs that revolve around that, and how can we get resources to the people that need it? Because we think, okay, you know what, it's infectious disease, it's a lot of that's what a lot of the funding goes towards as well, because it's sexy, and so, but we have to remember non-communicable disease. I know some people laughing that but that's how it works with the funding. And so non-communicable disease is the priority, and so it's one of our main priorities, of course, as well as continue to provide these kind of management of chronic illnesses. And so lastly, of course, with SGBV as well, something that's really, really crucial in the field, and that we do see, and so requires a lot of sensitivity, of course, and also with cultural competency, depending on the community perspective. And so I was very, very grateful to our midwife manager that was able to provide a lot of knowledge for us and to learn a lot. And so, it's something with less resources as well. This is something that you have to see, one-on-one and to be able to provide very, very sensitive care for. So lastly, also advocacy. And so I would say day to day as a nurse, we always advocate for our patients at the bedside. When we're deciding a plan of care for the medical team, when patients are deteriorating, you're really, really advocating for your patients to say, hey, I think we need to prioritize this. And so this looks a little bit different in the field. When you're one-on-one with the bedside, when you're in the field, you're having to oversee a lot of things. And so you're advocating for the patients and the resources that they require. And so not only are you working within your team, you're also working with the logistics team. You're also working with your manager to say, hey, I need funding for this, or I need these resources at this time so we can plan out this training, or because this is the priority. And so, in addition, you have to build these skills to advocate for what you need for your role. And of course, you as a manager also need to advocate for your team's needs, right? Their resources. For me, I had written a document based on their policies to say that, hey, I think we need this number of nurses because this leads to safer care. And so these are things that when across your time, when you recognize gaps, you're able to do, and then utilize those resources around you to be able to back up your argument. And finally, advocate for yourself. So, of course, I had said a little bit before that this was my first time in the field, and so I was able to approach my managers who was receptive and say, hey, I need a little bit more one-on-one time, a little bit more guidance, somebody to bounce ideas back and forth, and you can provide your expertise to me. But in addition, I also wanted more trainings, right? And I thought it would be really great to be able to do some coaching for my team, to help them with whatever their needs are. And so for myself as well, once you're finished this project, it doesn't mean it's your last. And so I had learned French during my time prior to getting into the organization. And so I always also advocated for myself. I'm like, hi, can I please continue my French training at this time because I didn't want to lose it, right? And so there's a lot of things that you could be doing in your spare time to continue to provide the skills that you need, and to be able to, have a career in the humanitarian health sector. And then we can move on. And so now that led to kind of my next role. Around the same time I had gotten the job, I had also applied for a role at Sigma Nursing's the official long name is Sigma Theta Tau International Honor Society of Nursing. So very long, but so now we just say Sigma Nursing. And I'm one of three youth representatives to the United Nations. And so we're able to utilize my resources to disseminate information, what I've learned, impact policy, and advocate on behalf of health, SDG 3 of health and well-being. And then throughout my time, I've been able to attend some of these conferences to contribute to policy and advocacy intervention. So back in June, I got to give an intervention at the Humanitarian Affairs segment on behalf of the current situation in the humanitarian field and also on behalf of nurses globally. And so within these skills that you've learned away, like I said, everything is a journey. I never expected to be here, but now you're able to utilize what you've seen to be able to impact these systemic and structural barriers that had frustrated you so much. And so that was something that was this is very new, and I'm still learning because the advocacy field is also very, very different in terms of how you want to get your interventions and how you impact policy. But so one day at a time, we're taking it. And so, if anybody's going to be at any conferences coming up, please feel free to reach out, and I'm always happy to connect. And so that leads to the end of my presentation. Thank you so, so much for joining me today. And I hope you had enjoyed your time here within some of the lessons that I've learned along the way. Thank you.